Hello, dear aquarist, dear koi keeper or pondfish keeper or goldfish keeper. Today you selected the video about a koi butterfly that had a serious disease, and I share you the different findings I collected in my PowerPoint because we found the parasites Chilodonella, we found a bacterial infection, and maybe a viral infection. I explain you what I can tell you about it with the help of my microscope. Diseases on fish, also on koi and goldfish, is available in my books in different languages. See the link below. Here we see the koi butterfly that was in very bad condition. You see the bad fins, the pectoral fin, which is necrotic, the bad nose, the whitish nose, damage. So a lot of things, of issues, making this fish in very bad shape. You could see the tail and fin damage on the fish. Here we could see the nose, which is badly damaged of this koi butterfly. You see that has a big hole, a gap inside. So we take scrapings, and of course we found a lot of bacteria collected from that nose part. We couldn't see any parasites or any worms or any other little bugs that were making the holes. It was bacteria. We took examination of the video, and we could detect, of course, the large quantity of bacteria. You can see them moving here. That's how you can see here the big colonies of bacteria, the darker parts that has a collection of millions of bacteria. You can see it here in the water. And in the fins, we found an interesting infection of parasites Chilodonella. You can see them here moving around and damaging further the tissue. Not only the bacteria has an impact here or have an impact here, it's also the parasites Chilodonella. And they can reproduce fast and increase the damage and the weakening of the fish. So we had the bacteria, then we had the parasites Chilodonella at the same time. When we dissected the fish, we could see the very bloody organs here. We saw a very enlarged kidney here, which is behind the swim bladder, but we open it here to show you this enlarged kidney, which is not normal. And we found that the kidney, well, had a lot of inclusions. The tubuli were filled with like a calcinous or how can I say, obstruction by dead organisms or calcium or dead blood cells not functioning properly. And at the same time, the spleen was very awkward. Look how badly this spleen looks like. It looks like very necrotic, big holes inside. We might suspect maybe a viral infection part of the cause. Yeah, this fish, well, that was beyond any treatment and due to the high serious damage that was done. So you can treat the other fish in the tank. In this case, this fish you should be gently asleep. You can apply an antibacterial and an antiparasitic medication for the other fish in the pond or the tank. Do it at the same time. Combine the treatments. Ask advice from your fish doctor or your aquarium shop. And do not wait too long, because when the disease has caused so much damage, like on this fish here, then it's too late. Maybe a viral infection was involved, and if you're dealing with a lot of fish and you want to invest a little bit of money to understand if a viral infection is coming on your fish, or maybe you can diagnose what kind of antibiotic to apply for the bacterial infection, yes, send your fish to the laboratory and they can help you to determine the disease or even help you in advice what medications to apply. At the same time, you can help with a functional fish food that helps the fish to repair. And here we could recommend, or Dr. Bassleer Bivalve Food Forte, or the grapefruit seed extract and moringa. Books on fish diseases, also on pond and koi fish, can help you to understand the prevention, to control the diagnosis. You can also get a training on fish doctoring, how to identify fish diseases, how to apply quarantining procedures at my Patreon channel. So I hope this short video helped you to understand certain diseases that can also appear with koi and also other fish. Watch my videos, subscribe to learn more. Thank you for watching.